My name is Roy Barnes, and I'm now a country lawyer, practicing law, but for years I was in public service in Georgia, 22 years in the General Assembly and 4 years as governor. First, anytime you tell an insurance company that they have to cover something, they're automatically opposed to it. And I finally just shamed the insurance companies. They had all signed off a few years before on mammograms. And I said to not allow prostate exams, for example, to be covered with that is hypocritical and wrong. And I used pure political persuasion on that. The other issues, there was not pushback. I did have some that says, well, I created an Office of Women's Health also, so that it would be balanced. But also, the greatest thing that I tried to push through all of that was regular examinations. And that's the reason I wanted to include the cost in health insurance of prostate exams, because I figured if they ever got in there, the doctor was just not going to look at that. He was going to do an overall examination. Now compare that with women, for example. Most all women are on a regular schedule of doing mammograms, pap smears, and other things like that. That's unheard of for men. And the whole idea was to try to replicate what was happening in the preventative care of women over into men. That was the greatest problem, is just to get over. Nobody disagreed with it. It's just that they would blow me off and, say, well, man, all that stuff. And it took an effort with the General Assembly, and Buddy Childers was very helpful giving testimony about that and speaking about it.